All right, to this now, the Human Sciences Research Council has released key findings of the 6th South African HIV Prevalence, Incidence and Behaviour Survey for the Western Cape province. Now, the council is visiting all 9 provinces to release the findings to the respective stakeholders. The Western Cape is the second last stop on the national survey program that the council released. Now, the council has found that the Western Cape had the lowest HIV prevalence at 7.4%, but it says there are areas of concern that need attention. SABC News reporter Mariska Botha has more for us.
We're coming to you from the CBD of Cape Town, where the Human Sciences Research Council has just released the key findings for the Western Cape in their 6th South African HIV Prevalence, Incidence and Behaviour Survey. And I'm not going to talk much about it. We're going to speak to the experts because this is a very important matter and we have to get it right. So we're speaking to Professor Sizulu Moyo, and she's the strategic lead for health and well-being at the HSRC. Professor Moyo, thank you so very much for your time. First of all, let's start with the results in the Western Cape. What do they tell you?
Thank you very much for the opportunity to speak about the results for the Western Cape that we released this morning. So the picture for the Western Cape is very much in keeping with what we found nationally. So we are seeing a slight decline in HIV prevalence. It was 8.6% in 2017. Now we've come down to 7.4%. We're seeing a drop of about 20,000 people living with HIV in the country. From 2017 was estimated 560,000. Now it's 540,000. And what we also see is that the peak, when we look at it by age groups, the peak of prevalence is not as high as it was in 2017. And also we're seeing that we've got more older people who are living with HIV. So we're seeing this aging cohort of people who are living with HIV, which is a good thing, telling us that people are on treatment, the treatment is working, and people are surviving to later stages of life. So that's something to be celebrated. It's also something for us to be aware that HIV is not only among young people, but also the older people who may have other conditions. That's something to think about. We're also seeing, though, that there are still gaps in the 95-95-95 care cascade. The 95-95-95 UNA's targets look at 95% of people living with HIV are aware of their status. Amongst those, 95% are being on antiretroviral treatment, and amongst those, 95% being virally suppressed. That is how we can end HIV. So while we've seen increases in HIV awareness, increases in being on treatment, increases in viral load suppression, we're not where we need to be. And I think that's where the work needs to be done. A key point is starting with the first indicator, knowing your status. People cannot get onto treatment if they don't know their status. So testing, that is very important. When we look at the percentages, once people know their status, they get onto treatment, they tend to do well. We tend to see higher percentages in terms of those who know their status who are on treatment and those on treatment who are virally suppressed. It's not where we want to be, but those percentages for the Western Cape are relatively high. But I think a key point is let's test, let's know our status, and then let's get onto treatment. The other issue that we need to talk about is what's driving HIV. The drivers of HIV, the behaviors that expose people to getting infected with HIV. Condom use has dropped across the country, and that's very important that people use condoms. Condoms are a very effective way of preventing people from getting HIV. So that's a message that we need to drive, that people really, we need to promote condom use for safe sex. The other thing that we also found is that when we ask people around PrEP, what do they know about PrEP? Would they take PrEP? There was a willingness amongst those who knew that if PrEP was to be made available, they would take PrEP. We know that oral PrEP is very effective. Now we know the results that came from, they were presented also from the work done here in the Western Cape by Professor Linda Gelbecker around the long-acting PrEP. So this data shows us that if these interventions were to be made available, people would take it. Yeah. And this would really be something that would be very helpful in helping us deal with preventing new infections. So I think that we need to continue spreading the message. Let's know our status. Once we know our status, let's get treated. Once we are on treatment, let's stay on treatment. The one other thing I want to point out is that we're focused generally around the 15 to 24, but because they've been the main drivers of new infections in the country in general. And we know that's around the age group when sexual activity starts. But the one other age group for the Western Cape to look at from the data that we showed is the pediatrics. We need to be aware that there is HIV in children. It was 2.3% in 2017. Now prevalence, we estimated at about 4.6%. So this could be because of new infections, but it also could be because these children are living and surviving. But what we need to look at is prevent the new infections, get the children into antiretrovirals, make sure that we're dosing them correctly, because children grow, right? Yes. You need to be changing the doses according to the weight. So that, to me, is another point that we need to be thinking about for the Western Cape. And then finally, for some of the indicators, when we wanted to break them down by sex and by age, we didn't have enough numbers. So if we come back to do the study, we really urge, the people in the Western Cape to participate. It's only when we have more people participating that we can have good data so that we can report on all the indicators by age, by sex, by where we live, because then we can target the interventions, because there is no one size fits all. Yes. We need to be specific to what people need, then we can be effective.